Picture this. Your neighbor just turned 65. She's excited about Medicare. She shops around and she finds a plan with a $0 premium. Zero. She thinks she just won. Fast forward 18 months. She has a health scare, ends up in the hospital for 4 days, and walks out with a bill for over $6,000 out of pocket in retirement on a fixed income. That is not a rare story. That happens every single day to people who made their Medicare decision based on one number, the monthly premium, without ever looking at the full picture. Welcome to Retirement Security Simplified. I'm here to help you avoid exactly that kind of surprise. And today, we're going to do a real honest apples to apples cost comparison between Medicare Supplement and Medicare Advantage using 2026 numbers so that you can walk into your Medicare decision with your eyes wide open. Let's get into it. Before we get to the numbers, let me give you a quick plain English explanation of what these two options actually are, because a lot of people are a little bit fuzzy on this. Original Medicare, that's parts A and B, covers a lot, but it doesn't cover everything. There are gaps, co-pays, co-insurance, deductibles, and those gaps can add up fast. A Medicare Supplement Plan, also called Medigap, works alongside original Medicare to fill in most or all of those gaps. You pay a monthly premium for the supplement plan, and in exchange, it picks up what Medicare doesn't pay. And here's the big one. With a Medicare supplement, you can see any doctor or go to any hospital in the country that accepts Medicare. No networks, no referrals, no permission slips. Medicare Advantage is a completely different animal. Instead of working alongside original Medicare, it replaces it. A private insurance company manages your coverage. Most Advantage plans have a $0 or very low monthly premium, and many of them bundle in extra benefits like dental, vision, and hearing. Sounds great on the surface, but they come with networks, usually HMO or PPO structures, and there are co-pays and cost sharing every time you use the plan. Now, which one actually costs more? Let's run the real numbers. This is a section I really want you to pay attention to because this is where most people get it wrong. Let's start with Medicare Supplement, specifically Plan G, which is the most popular Medigap plan available in 2026. With Plan G, you pay a monthly premium. The premium varies based on your age, your gender, and where you live, but for our example today, let's use a very realistic mid-range figure of $160 per month. That's $1,920 per year in premiums. Now with Plan G, there is one out-of-pocket cost, the Part B deductible. In 2026, that deductible is $283. You pay that once at the beginning of the year, and after that, for the entire rest of the year, you pay nothing. Zero copays, zero coinsurance, zero hospital bills. Nothing. So your total estimated annual cost with Medicare Supplement Plan G in this example, about $2,203. And that number is highly predictable. You know it going in. No surprises. Now, let's look at Medicare Advantage. Here's where it gets interesting. The premium on many Medicare Advantage plans is $0 per month. And I completely understand why that's attractive, especially if you're on a fixed income in retirement. $0 is a very compelling number. But here is what you need to know. Whether you have a Medicare Supplement or a Medicare Advantage plan, you are still required to pay your Medicare Part B premium every single month. In 2026, that's $202.90 per month, or $2,434.80 per year. That applies to both plans equally. So before we even talk about copays, everyone is starting at the same Part B cost. Now, with a zero premium Medicare Advantage plan, every time you use it, there are costs. A primary care visit, typically $10 to $40 in copays. A specialist, $40 to $80. Going into the hospital, many Advantage plans charge around $350 to $400 per day for each of the first 5 days of an inpatient stay. That's potentially up to $2,000 for just one hospital admission. And here's the number I really want you to hear. The out-of-pocket maximum on Medicare Advantage plans, the absolute most you could be required to pay in a single year, is set by the federal government. In 2026, that cap is $9,250 in network. That's the legal ceiling. And many plans are right up near that limit. So let's put this side by side. With Medicare Supplement Plan G, $160 a month in premium, a $283 deductible, then nothing else to pay for the year. Best case and worst case almost look identical because the plan is predictable by design. Total annual cost in our example, roughly $2,200. With a zero premium Medicare Advantage plan, no premium, but copays adding up every time you use the plan. In a healthy year where you barely use it, maybe $500 to $1,000 in copays. In a year where something serious happens, a surgery, a hospitalization, a cancer diagnosis, you could be looking at over $9,000 out of pocket plus your Part B premium. Let me say that again. In a bad health year on Medicare Advantage, your out-of-pocket cost could be over $11,000 on a fixed income in retirement. That is a number most people never see when they sign up. Beyond the numbers we just walked through, there are some hidden costs and risks with Medicare Advantage that I want to make sure you're aware of, because these don't always show up in the premium comparison. The first one is what I already mentioned, the $0 premium illusion. That $0 premium is not free coverage. You're still paying for your Part B premium every single month. The insurance company actually receives a payment from Medicare on your behalf for enrolling you. The zero premium is a marketing feature, not a sign that the coverage is free. The second hidden cost is network lock-in. With Medicare Advantage, your care is tied to a specific network of doctors and hospitals. If your primary care doctor leaves that network, you may have to find a new doctor or pay significantly higher out-of-network costs. If you need a specialist who isn't in network, same problem. With Medicare Supplement, that simply doesn't exist. Any doctor who takes Medicare takes your plan, period. The third hidden cost is prior authorization. Medicare Advantage plans frequently require you to get prior approval before certain procedures, specialist visits, or treatments can move forward. That means delays. And in retirement, delays in medical care are not just inconvenient, they can be dangerous. This is one of the most common complaints among Medicare Advantage enrollees. The fourth hidden cost is the travel problem. If you travel, if you spend winters in Florida and summers in North Carolina, or if you want the flexibility to get care anywhere in the country, Medicare Supplement is built for that. Medicare Advantage plans are built around a local network. Emergency coverage may be available out of area, but routine care typically is not. And the fifth hidden cost is what I call the sicker you get problem. Medicare Advantage plans are financially designed around members who stay relatively healthy. The more you use the plan, the more doctor visits, the more procedures, the more hospital stays, the closer you get to that $9,000 out-of-pocket cap. The people who need the most coverage end up paying the most. That is a fundamental design difference from Medicare Supplement, which pays more as you use it more and charges you the same flat premium either way. I want to be honest with you here because I don't think any one plan is right for every single person. What I believe is you need to go in with accurate information and make the choice that fits your actual life. Medicare Supplement, specifically Plan G, is likely the stronger fit if you want cost predictability in retirement and you can't afford a large unexpected medical bill. It's the right fit if you have ongoing health conditions, if you take multiple medications, if you travel frequently, or if having the freedom to choose your own doctors without asking for permission matters to you. For most retirees on a fixed income who are focused on protecting what they've saved, the predictability of Medigap is genuinely valuable. Medicare Advantage may make sense if you are in excellent health. You rarely use medical services, and the premium savings are truly important to your monthly cash flow right now. It may also work well if the bundled dental and vision benefits fill a real gap for you, and if you have a strong local network in your area with providers you already know and trust. But here is the most important thing I want you to take away from this section. This decision doesn't happen in a vacuum. Your Medicare choice affects your cash flow, your retirement income, and how much of your savings you may need to protect against unexpected medical costs. It's connected to your whole retirement picture, not just your health insurance. Let me bring this home with one thing I want you to remember from today's video. The real cost of Medicare is not the premium. The real cost is what you pay when you actually need care. And for retirees living on a fixed income, that difference between plans can be thousands of dollars in a single year. A $0 premium can cost you over $9,000 when life gets hard. A $160 premium monthly can cost you that plus that deductible no matter what happens. Those are two very different realities, and you deserve to know both of them before you choose. Now, your Medicare plan is just one piece of your retirement income puzzle. How you coordinate it with your Social Security income, your retirement savings, your tax picture, all of that matters. If you'd like to learn more, take a look at the free booklet called Retire Smart. It's available on the page that's linked in the description box. And if today's video gave you some clarity, please hit the like button. It helps more people find this channel. Subscribe so you don't miss our next video, and share this with someone you know who is heading into Medicare decisions soon. They need to see these numbers. This is Retirement Security Simplified, where we specialize in turning confusion into confidence, one conversation at a time.